The unique feature of our app is the context-aware intelligent agents which are programmed to follow clinical practice guidelines to assist patients in tracking and recording evidence-based data in real time. At the first start in using the app, patients will program the symptom baseline setting feature by entering the usual baseline symptoms that they experience in living with their heart failure disease. Patients only need to remember the usual time and activity that they experience their baseline symptoms during the setup and may select multiple baseline symptoms for monitoring. Now, with this feature, the Smart Symptom Verification will prompt patients according to the time set and ask if they are experiencing the baseline symptom. Whenever a patient verifies it is true, the context-aware intelligent agent will recall from the previous setting the characteristics of the heart failure symptoms to ask if it remains the same or if any changes, patients can edit. It will also ask specific heart failure symptoms characteristics for the patient to record in real time. It assists patients in knowing what symptoms are relevant and how to place changes in context of objective data. After the patient has verified it, the intelligent agent will automatically prompt the patient to log in their vital signs. If a patient is out and does not have their medical devices to measure, it will remind again within every 12 hours as long as the patient records the vital signs within the 24 hours of experiencing the symptoms. If the patient records a new symptom, the intelligent agent will automatically prompt the patient to record vital signs within 24 hours. These data create an evidence-based individualized self-monitoring record to assist patients in differentiating between usual and new symptoms, as well as augmenting their knowledge about heart failure management. The unique feature of our clinician web app is the intelligent agents that automatically sorts alert data of patients' symptom severity trends. It personalizes the data visualization according to roles and expertise of physicians in the management of the heart failure patients. Clinicians can remotely view patients' individualized self-monitoring records and call patients for an earlier schedule if needed. Clinicians can remotely view patients' individualized self-monitoring records and call patients for an earlier schedule if needed. The patient will get a prompt in the morning to verify if he is experiencing any difficulty sleeping symptoms. The time for prompting follows what the patient has set during baseline symptom setup. Patients can bring their smartphone during their usual activity in which they typically experience their baseline symptoms. For heart failure patients, this is important because the severity of their symptoms within the activity that occurs can help indicate whether the symptoms change due to a worsening heart failure status. The patient can have an overview of whether the medication is optimized by correlating the baseline symptom severity, if there was any new heart failure symptom, and the vital signs trends. In this case, the patient wants to share his day overview with his physician because he is rather worried about the new symptom and increasing weight trend. During the clinic visit, clinicians can access the patient's self-monitoring record to have better information and understanding of the patient's health status. The symptom chart can be used as a shared ground for clinicians to establish a common understanding with patients regarding the patient's quality of life at home.